So why are chronic illnesses on the rise? And these are the main reasons that we find the chronic illnesses, that we're not finding cures for chronic conditions. We're living a longer life, and we're living with more chronic health conditions. We have a rising rate of obesity that is leading to a lot of these health issues. But I'd say that with the aspect of that you can be fit and fat. So even if you are a larger person, being physically active can be a very good help in decreasing your risk of heart conditions. So you don't have to, I'm never going to go from here to here. That's just not possible. But if I can lose 5 to 7% of my weight and maintain it, or where I am maintain my weight, I'm better off in being physically active. Okay? And the tendency is that a lot of us aren't as physically active. And we're even teaching our children this, is that, I don't know, I mean, I had to stop my kids from actually hitting the button to open the door, that actually opening the door and using your arm is a good thing. And so that's a piece where we take advantage. There's a very good commercial by Bassell Margarine where they have people on escalators and the escalators stop and they start screaming for people to help them. They don't move. And I think that's one piece is we forgot that our bodies were meant to move and we need to move them. And we need to think of exercise as a prescription. It's not an easy thing to do. I can talk myself out of it very quickly, but it's a very important piece. And the increase in immigration from higher risk populations. And especially within our LHIN, we do have a high population of immigrants. Okay. So these are some interesting studies that have, and where we are in the data. And it's interesting. So we're talking smoking, physical activity, sedentary behaviors, healthy eating and unhealthy, and alcohol. And these are all the factors that if we could actually change these, we actually could prevent some of the chronic health conditions that we talk about. So like smoking, the percentage of population reported being currently daily smokers over the age of 15, 11.9% are still smoking. It's not an easy thing to quit, but it is to know that people are still out there and smoking. Physical activity, that the percentage reported being physically active or physically and moderately active is 51.9%. So still less than 50% of people are still not being active on a regular basis. Sedentary life. I think this is really interesting. We talk, well, the rest of them are actually sitting more than 14 hours a day. 62.1% have a sedentary life. And they're worried about that. They're saying the more that we sit at our job, that could be a concern. The more that we're sitting, that actually getting up and moving can be very helpful for our heart health. Healthy eating. How many of us are having our 5 servings of 5 times a day of vegetables, and that's only at 40.3%. So we have some room to move on these. And that's all just saying this. It's not like, oh, I'm not doing this and I'm not doing that. It's more like where we have a place to start from. How can we move this forward? How can we be more active? How can we start looking at vegetables? How can we want to do that? And that's the really big piece around self-management, is the want to do it. And unhealthy eating between the ages of 9 and 19, there's still a lot of them drinking the soda drinks. We haven't become the province that's cut that out, like New York City, where they cut out those big drinks. And then alcohol use is still at 14.4%. So it's just some interesting factors to know about. And as I said before, this is really, you know, it would be 80% for heart disease, diabetes, and respiratory diseases. 80% would decrease if we were stopped these things, if we could quit the smoking, start getting our diet healthier, physical activity, and decreasing alcohol use. 40% in preventing cancer. So it's really actually quite effective that these are the pieces that if we could actually decrease these risk factors, we actually could prevent some of the chronic health conditions that are around.